Hi, my name is Katie Cook, and for my data analytics project, I chose to focus on Alzheimer's. Alzheimer's is a type of dementia that causes problems with memory, thinking, and behavior. This disease accounts for nearly 60 to 80% of all dementia cases. The most common symptom is difficulty remembering newly learned information. Currently, there is no cure, but treatments for symptoms are available and research continues. First, let's focus in on Alzheimer's in the United States as a whole. It is currently the sixth leading cause of death in the United States. There are currently more than 5 million Americans living with Alzheimer's. I wanted to see if this population health issue would affect male and females equally, or if there is one sex that suffers significantly more from this disease. Now, let's focus in on Alzheimer's in Ohio. There is an estimated of 210,000 adults with Alzheimer's. In 2025, it's estimated to reach nearly 250,000 adults. As you can see in the table, there are millions of unpaid hours that are put into caring for these Alzheimer's patients, which roughly estimates to over $8 billion of unpaid care. For my research, I decided to focus in on two questions. First, is there a difference between the amount of males and the amount of females that have Alzheimer's? Second, is there a cost difference between the out-of-pocket costs of males and of females? For my null, I stated that there is no difference between the two variables, and then for my alternative hypothesis, I stated that there is a difference between these two variables. The statistical methods that I used were the chi-square test, the independent sample t-test, and a confidence interval. The chi-square test was used to test two different nominal variables, whereas the independent sample t-test was used for a ratio and a nominal variable. The dataset used was collected from the 2010 Medicare members dataset. It was not cleaned up or edited in any way, and I had no issues with the First, let's take a look at the chi-squares test. I use this test to compare the sex of the patient and whether or not they have Alzheimer's. As mentioned earlier, these are both nominal variables. As you can see in the table on the right, there is a difference between the observed and the expected count for each sex and for those who do and who do not have Alzheimer's. But is this difference significant? In the table on the left, you can see that the p-value is less than that of alpha, which is 0.05, causing me to reject the null hypothesis and state that the value is statistically significant. The next test that I ran was the independent samples t-test. Here, I compared the out-of-pocket cost of each patient and the sex of the patient. As mentioned, I use this test because I'm comparing a ratio and a nominal variable. As you can see in the highlighted portion, the p-value is less than that of alpha, being set at 0.05, which would cause me to reject the null hypothesis and state that the p-value is statistically significant. Finally, from the independent sample t-test, I calculated the confidence interval between the out-of-pocket cost and the sex of each patient, which is highlighted here. To recap from the three methods, I found that there is a significant difference between the sex of the patients and whether or not that they have Alzheimer's. I also found that there is a significant difference between the out-of-pocket cost and the sex of the patients. This causes me to wonder what we should do with the knowledge of our results and if we should put any new policies in change to help those who are going to be affected by this disease. In conclusion, 90% of what we know about Alzheimer's has been discovered in the last 15 years. Due to the results, this causes me to think, is there a difference between the gender? Is the difference that is between the gender, does it have an effect due to the genes, hormones, or simply living longer? Will policies be put in place to help educate the gender of the higher prevalence? Hopefully, further studies will help support my conclusions. and this is my works cited for my information.